Hi, everybody. Thanks for joining me today. We should have Dr. Khan in a few minutes. He'll be joining me live on the show. And we're going to be talking all things around autism and COVID. So if you've got any questions, please do pop them in the comments box, and I'm sure we'll answer the questions. Lots of questions have been coming in, and we will answer them to everybody online very shortly. So if you've got any questions for Dr. Khan, please excuse me, do post them down below in the comments box and we will answer them. We've had lots of questions around the last week, people's concerns around COVID and autism, and I'm sure Dr. Khan will answer these questions live on air this morning. So if you've got any comments, please do post them below. I've got lots of comments have come through at the moment. We'll try and get through as many as we can. So if you post your comments, and we will try and answer them. So he will be joining me in the next few minutes, hopefully. As technology, sometimes things can go wrong, but I'm sure he'll be joining us very, very shortly. So please do bear with us, and we'll go through the series of questions. So if you've got any questions, do post them below, and we will obviously answer them for you. So he should be appearing, hopefully, very, very shortly. So yeah, lots of questions have been coming in around different things around GP doctors, around the NHS, and different, questions from people with autism and parents who are concerned. So hopefully we will be live just in a few minutes. So sometimes these things can happen when we go live. We can have technical issues. So hopefully you'll be with us a second. So apologies for the slight delay. Hopefully you'll be joining us very, very soon. So if you've got any questions, do post them in, and we will get through as many questions as we can. I'm just going to send Dr. Khan another message. So if you just bear with me, guys, and we'll see if we can bring him in on the broadcast. I think he should be joining us very, very soon. Dr. Khan, thank you so much for joining us.
Kevin, I'm so sorry I was late. I went to do like 2 things in the garden and then I completely lost track of time, and then I realised at the last minute that it was 10 o'clock already.
Don't worry. Thank you so much for joining us. We've had lots of questions coming in. So I'll try and get through some of the questions. Have you got an echo on your side? Because I've got an echo coming back.
Have you? Should I get some earphones? Would that be better?
Yeah, if you don't mind, yeah.
Yes, give me 1 second.
Thank you. If you've got any questions for Dr. Khan, please do drop them back. I've got an echo coming through. So that's one of the annoying things when you're doing a live broadcast and you've got an echo. I can hear myself talking. Excuse me. So if you've got any questions, please do post them below, and we will try to answer as many as we can.
Right, I'm back. Sorry about that. Let me just try this. Is that better for sound?
Oh, that's brilliant. No, I can't hear
brilliant.
myself echoing, but that's the worst thing when you're doing a live broadcast.
You'll realise, Kevin, that I'm horrendous with technology, so I apologise for that in advance.
No, don't worry. Don't worry. And if you're not following Dr. Khan, do follow him on social media. I've been watching his tweets recently. They're absolutely brilliant. He's in the Guardian. I saw him in the Guardian yesterday doing, what were you doing? You were doing press ups and you were clapping your hands at the same time.
I was, yeah. I didn't think I could actually do it, but I'm an ambassador for a charity called the Wildlife Trust because I'm big into wildlife and how that is good for mental health. And so they were going to have lots of money raised for them through the London Marathon, which was supposed to be on the weekend, but obviously it didn't go ahead. So I did it as part of a challenge to raise money for the wildlife trusts. And we did really well. So I'm really grateful for everyone who supported that. So thank you. But yeah, it was a press up with a clap, 26 press ups with a clap in between. And yeah, I surprised myself, to be honest with you. I surprised myself.
I was actually exhausted just watching you.
Yeah, I was really pleased with myself. I did go and have a big bar of chocolate after that, though, to be fair.
I don't blame you. By the way, you've got a wonderful garden. I was looking at the videos the other day of your garden. It's really, really, really nice. And I suppose that's what you do, is it? When you're a GP, obviously you're very busy at the moment, and it must be quite stressful being a GP. Is that your way of how you relax?
It really is. At the moment, it is very stressful being a GP. Well, not stressful. That's probably the wrong word. It's hard work and it's different work. You know, we've got our usual stuff coming in, but we've also got the added pressure of the coronavirus, particularly patients in care homes at the moment, where we're really looking after them and, you know, putting a big effort into that. So after a long day, the garden is just a great place for me to go into and just unwind and relax and just watch the birds and kind of forget about what happened that day, because it can be very sad. It can be very rewarding as well, my job, but at times it can be sad. So it is nice to go into the garden and just get that kind of breather from it all.
That's great. So can I just say thanks, you know, thanks for what you're doing, and thanks for the many thousands of GPs up and down the country who are saving so many people's lives out there. And, you know, I just take my hat off to you all, because there's so many, you know, people who are professionals like yourself who risk, you know, you're risking your lives every single day, saving lives of others. So, you know, on behalf of the autism community, I just want to thank you.
Oh, thank you. It might be a good opportunity for me to say that my niece actually has got autism, and so I have some personal experience of that. She's now 24 years old, but you know, she's had it obviously since she was born. It was a late diagnosis, as it often can be, and my sister and her husband and their son, who's her brother, are doing an amazing job, and I understand how difficult it can be in the lockdown. So I do have some, and I speak to her pretty much every day on the phone to see how she's getting on. And yeah, I know she's finding it tricky as well herself in different ways. Some bits of it she enjoys, some bits of it she doesn't like. So I think it's a bit of a mixed kind of picture for her.
So is she verbal or non-verbal?
She's verbal.
Verbal.
So she can talk. Yeah.
So do you think, as a GP, obviously you must see lots of people with Asperger and autism in your practice, and would you say that people's anxiety with autism is much heightened for those who are aware to those who aren't aware, who've got non-verbal? You know, yes. So for example, Matt, when he's non-verbal, he's severely autistic, so he doesn't understand what the coronavirus is. He doesn't understand that we have a pandemic. So obviously, he's got no, you know, he doesn't have any understanding of diseases or illnesses. So Do you think with people with autism, it's more obviously more heightened for them?
I think it definitely is, because for those people who don't have autism, or have the verbal version, it can be much easier to understand, and why you have to do the certain things. But when you haven't got that, it's hard to understand why your whole world has changed and why your routine, I think that's the key thing, has changed. And it is hard to explain it to people. And I've had parents ring me up about how they can explain it to their children, both with autism and without. And my response is very, very different. With children without autism, it's about explaining it in real terms that doesn't scare them. But when with children with autism, depending on where they are on the spectrum, it's about explaining to them, why their routine has changed and why certain things can't be done at certain times, and I think that is really hard for parents. And often, I mean, we don't hear about that. I certainly don't hear about it on the news or in any other kind of media, because there's a lot to cover, but this is a really important aspect of it. And so yes, I've had conversations with my patients who are parents to children with autism in particular about what the best way is to do it. And I've got a brilliant nurse at the practice called Debbie Harris, who's a children's nurse, and she is excellent at explaining all of this to us. So if I'm struggling, and I do struggle, I'll be honest, I can struggle in explaining it to people with autistic spectrum disorder. I'll put my hands up there, but she's brilliant, so I will default to her if I am struggling at all.
Do you know, around the moment, the government are saying that people with autism, I don't know if you've seen it, people with autism can actually go out and exercise more than once because of their autism. Yeah. Do the parents have to get a letter from the GP to? No, not at all. So if you have a child with autistic spectrum disorder and they are fine to go out more than once a day, because it will help them and it will help them understand things, it will help them break up that monotony of staying indoors all the time. You don't need a letter from your GP. We'd be happy to give you one if you feel you'd be better off with it. But those guidelines are well understood by the authorities. So I can't imagine anyone stopping a family when they're out anyway. But if they do, the authorities should know that. So there's no need for a letter. So if that's what's stopping you from going out more than once a day, please don't let it. There is no need for you to have any documented evidence for that. Yeah, because we had some questions, and last week some parents were concerned because they didn't know whether they had to have an official letter signed by the GP to say, your son or daughter can go out, so many times a day, and there's a bit of confusion around that.
No, it's not that prescriptive. And like I say, if a parent rang me up and wanted a letter, I would say to them that you don't need it, but if you really want... sorry, I just got to... Oh, hang on, I'm back. Can you see me still?
You're back. Yeah, disappeared then. Yes, you're back. Are you there?
Oh, right. Yeah, sorry, I lost...
Yes, you are. Let me just add you back in. You are there. Can you hear me?
I've just lost the audio. I'm sorry. Just bear with me.
Can you hear me?
Kevin, can you hear me?
Yeah, I can hear you. Can you hear me?
See, I can't hear you. I can just about lip read what you're saying. Sorry. Just
do you want to try take the headphones out and plug them back in? Headphones out.
Yeah, I'll try that.
Can you hear me now?
Can you hear? You can't hear me.
I can hear you. Can you hear me?
Try plug them back in. Can you hear me now?
Yeah. Can you hear me?
Oh no, I can't hear you. I don't know what's going on. I tell you what I'll do, Kevin. I'll reconnect with you. Just give me a second.
Okay.
Sorry about this. I did say I was terrible.
So if you've got any questions, please post them below. There's a few technical issues at the moment. We've got the form, you'll be joining with us in a few more minutes. So apologies about that.
I'm back. I can hear you, Kevin.
Oh,
sorry,
brilliant.
I got a call from the practice, and they just kind of chucked everything off kilter. Yeah, I'm sorry about that.
That's okay. So you're saying before?
Yes. So if a parent wants to ring me up, I would say to them again, you don't need the letter, but if you want it, I'd be happy to do it. But the easiest thing is just you've got the government guidance there. You know your son or daughter, and you can take them out as you see fit. Don't wait for a letter, because a lot of these kind of things, printing out letters and all that, can take time, and you don't just go out, just do it. You've got the right to do so.
That's brilliant. Thanks for clearing that up. So I've got one question from Darren. He says, I have got a question. Why is it that the death rate in the UK is constantly rising, and the recovery rate is constantly stuck at 135? I'm not sure what he means by that. I don't know if you know.
Yeah, well, it's difficult with the recovery rate, because what the death rate refers to is only people in hospital who have died in hospital. Lots of people will have had the virus and been advised to stay at home and got better within a week or two. And there's no record of that anywhere, because they're not being tested, which is another issue. And so we don't hear about the hundreds of thousands of people, and it will be hundreds of thousands of people, who have had the virus, have had mild symptoms, and have recovered at home. And so that's why the recovery rate isn't being recorded very accurately, whereas the death rate in hospital is being recorded. The death rate in the community, in care homes and that kind of thing, hasn't yet been recorded or given to us. But that's why the recovery rate feels low, but it'll be much, much, much higher than what we're getting there.
Okay, then. So we've got some more questions here. Olivia says, if my son was to go into hospital due to his clinic tonic seizures, would I be allowed to be with him because of the coronavirus?
It's a really good question. So hospitals at the moment are set up in two different ways. So there'll be a very clear area, either in A&E or in the clinical areas, where patients who have symptoms consistent with the coronavirus will be directed towards. Everyone else will be very separate in a different part of the same hospital. So if your son was to go in with a seizure, and a tonic-clonic seizure is one of the big type of fits that people with seizure-related illnesses can have. Yes, you will definitely be able to go in, and you'll definitely be able to, depending on his age, I don't know how old he is, but you will be able to stay with him if he's a child, as you normally would. And these would be on wards where there'll be no COVID patients, because they will be kept very separately to minimize the risk of spread. And I know a lot of people are really worried about going into hospital if they've got illnesses, but if you are unwell and you are poorly, GP surgeries are open, hospitals are open, and they're safe to go to. And it's really important that you go and see people rather than let things linger until it's too late. It is safe. And there's a lot of things in place to reduce the risk of spread. At us at our GP surgery, we see our coronavirus patients in a different building compared to our non-coronavirus patients. So if you are worried about that kind of thing, your GP surgery will have a similar setup.
Yeah, because I know a lot of parents were saying last week, they obviously with this lady with her son with the tonic seizures, but other people were saying if their child or their adult has got autism and they get struck down with the coronavirus and they go into hospital, would they able to accompany their child or adult? So would that be the same issue?
So sorry, just so I've understood that question, would the child or adult be able to? So if the adult went into hospital with coronavirus, is that the question, or is it
on both sides actually? So
right,
if a parent who's got coronavirus, would their child able go in? And two, if the child or adult's got coronavirus, would the parent able accompany? I know it's two questions.
Yeah, no, I'll answer the first one. So it might not be what people want to hear, but if it's an adult with coronavirus, the child will not be able to go in and visit them or accompany them. And that is because of the risk of infection to that child. And also that child, because it's been in the same household, he or she's been in the same household as that parent who's now got the illness, really should self-isolate for 14 days. And they shouldn't be leaving the house at all. And that's to reduce the risk of spreading to other people in the community. Depending on the age of the child who gets a coronavirus and goes into hospital, if it's a very, very young child, then parents will be able to go in, but there'll be limited access to the child. So if they do go into the room, they may be confined to that room. There'll be very strict procedures about protective gear they have to wear and the washing and handling afterwards. If it's an older child, usually above 12 or 13, then there may be very strict, limited access to visiting the child because of the risk of spread. But each case, there's no broad stroke here. Each case is going to be individually assessed, and it depends on the severity of the illness, where the child is on the spectrum disorder, and all of that kind of stuff. So everything will be decided on an individual basis. But the one thing I will certainly say is if an adult goes in, the child won't be able to go and visit.
Okay, that's great. Another question here. Sorry about all these questions.
Oh, it's okay.
Linda says, if my boyfriend lives next door and is on my care plan, is he allowed to check on me because I'm autistic and live alone?
That's a really tricky one. So essentially, people from different households shouldn't be mixing. There are different ways he can check on you. He can do it via video calls or telephone calls. And if it's urgent, an emergency, then he may be able to come into the household then. It is hard. I understand it's hard. But we have to look at, the risk of it spreading, and households spreading within households is the biggest way it spreads. So strictly speaking, no, he shouldn't be coming into your home unless it's an emergency, and he can check on you. I know, again, it's not ideal, but via video call or phone call.
Yeah, because I've seen some messages on social media where young adults have got autism and they've been visiting mum and dad and going into mum and dad's house, and I've been saying, really, that shouldn't be happening.
No,
you should do video calls, like you say, you're on the phone.
Because,
yeah,
and it's tricky for me to say because I'm not in that situation, and I don't fully understand what it's like to be in that situation. My niece, who's got autistic spectrum disorder, lives with her mum and dad, so it's different. But from a very strict kind of policy point of view, they shouldn't be doing that. But when you're living that experience, and you're the parent or you're the child with that condition, it's hard to say apply these broad rules to it. But strictly speaking, they shouldn't be doing it.
Okay. Wendy on Facebook, she says, as a mum of 2 autistic young adults, I'd like to know, how can we get the COVID-19 hospital passport in case our autistic children has to go into hospital but would struggle to communicate their needs without me by their side all the time, just in case I can't stay as I've got autoimmune condition?
Yeah, so Wendy with an autoimmune condition is herself at high risk of developing the complications of coronavirus should she get it. The best way to get the passport is to speak to her normal paediatrician who's in charge of the children's care, the community paediatrician who normally the children would be seeing, and they'd be able to issue that passport for them. Unfortunately, us GPs can't issue it. It has to come through the consultants at the hospital.
Is there a template where anybody can download a passport to fill in themselves?
I'll be honest, Kevin, I'm not aware of one. There may well be one, but I'm not aware of one. They haven't made us aware of things. Normally, they would email us about all this kind of thing and let us know that these things are available so we can advise our patients. But I haven't received such an email. But I may be wrong, so I can't say for sure that isn't the case.
Okay, then I've got a message here on Twitter. Just bear with me. Well, I'm finding that one. I'll bring the ones up on the screen here. So we've got one from Gemma. I don't know if you can see that on your screen.
Oh, yeah.
Gemma on YouTube, she says, how does COVID affect people with autism? As I feel that COVID has not been explained to people with autism.
Okay, so the coronavirus or the COVID-19 disease itself, in terms of how it affects them from a physical point of view, it's no different to people without autism. So if you've got autistic spectrum disorder, you aren't at higher risk of developing the complications of it. It doesn't put you in a high risk category. It's difficult. Explaining what it is a trickier thing, and that has to be done depending on each individual. How the best way to explain it to them is. I always think being as honest as possible, depending on the ability of that individual, is the best way, and that's what I would suggest. But in terms of its severity and how it affects people. It's no different to people without autism.
Yeah, okay. Christina on Twitter, she says, I'm working, so I'll miss the show, but we'll watch on replay. She says, could you give me some advice on how to deal with autistic children who are regressing due to lockdown? How is the best way to help them?
Okay, so what I would say to that is routine is really important. So anything that they would have normally done before the lockdown, if it's still possible to do, so anything within the house, any learning activities that they would do, try and maintain them. If they would have done them at school, try and do them at home. Getting outdoors is really, really important, and it breaks things up. And if they've got a garden, doing things there. But again, explaining to them what they're going to do before they do it, and making sure they understand everything, so it's not a surprise when it happens, is key as well. And then try and get them outside as often as possible. Explain to them why things have changed. Explain to them why people aren't visiting as often as normal, and why perhaps key workers or teachers or carers aren't coming round, and that's really important. But anything that those people were doing before the lockdown that you are able to do yourself, try and do that as much as you can. And I know it's hard when you're working. It sounds like she's working as well, and it may well be a key worker herself. But if there's anyone else who can do that, it'd be really helpful.
Yeah, because I think there was some confusion with people, parents going outside with their autistic child or adult, and they were confused with how long can they stay out for? Can they go? Because I know there's some sort of guidelines which I read that they could go out to. Can they go out of their own area if they want to go to like a park, a big park, or have they got to be close by?
So the guidance has slightly changed with parks now. So you can drive up to an hour to go to a park, and that applies to everyone. It's been slightly relaxed since the extension of the lockdown, and that's really more to stop people from congregating all at once in one park. So it spreads it out a little bit. So you can drive a little bit, and I would say yes, do definitely take them out. And if you don't have any green space or open areas or things that they enjoy doing around you, then you can drive up to an hour to get to these places.
Okay, Jamis says again, also, could the language be made more accessible to people with autism? I find it so confusing.
Yeah.
I suppose it's a difficult question, that one is, because I know lots of GP practices have got, easy read information, and the government supplies easy read information. But I suppose it depends on where you are on the spectrum.
That's right. Yeah.
Our information.
Yeah, it will depend on where you are on the spectrum, and how much you want to know as well. Because if you want to know everything, then there is ability to do all of that. If you're confused by any of the language, and if you can't find the information that you want online, I would suggest ring up your GP, because we are doing telephone consultations. And honestly, if someone rang me up who had autistic spectrum disorder and said, I don't quite understand this, or I don't quite know how to explain it to people, I would have the knowledge of that individual patient as their GP, and I'd be able to explain it to them or their children if needed. And I've done that before, so it's not an unreasonable request. So if you're worried, if you're not quite sure, ring your GP. They have a better understanding of you as an individual, and they'll be able to explain it in words that will be best for you.
Okay, we've got one message on Periscope. My son's not sleeping even with melatonin, frustrated and self-harming by banging his head. Non-verbally is 3. That's a difficult question, that one is, I suppose.
Yeah, and I can understand how horrible that must be to see, and how hard it is, and how frustrating. What I would suggest is 2 things really there. Either speak to, so melatonin is a medication given to people to help them sleep, usually children, and what you can do is speak to your pediatrician. So you can ring up the secretary, because it's normally prescribed by a consultant at the hospital rather than the GP, and so you can ring the secretary of the pediatrician and get a phone call back from them to see if you can change the dose, or if there's any alternative to it. If you're struggling with that, you can ring your GP and speak to them, and they often can get hold of the pediatrician and get some advice for you, because we can do things like electronic consultations, where we can email the consultant at the hospital and we can get a reply that way. So my advice would be, first try the paediatrician at the hospital, his or her secretary. If that fails, then speak to your GP, because there are things that can be done to help. And sorry, someone's called me again. Hang on.
So we've lost Dr. Khan there. Hopefully we'll be back with us. We've only got a few more questions, but if you can't come back to us, we'll try and answer them. Oh, he's Dr. Khan's back.
I'm
Hi,
back.
Dr. Khan.
I'm so sorry. I keep getting phone calls, and I'm on my phone, so that's why it keeps getting cut off. I did well, yeah. I'm sorry about that, but yeah,
Don't worry,
speak to the paediatrician, or alternatively your GP.
Yeah, Becky says on Facebook, I can't get hold of a mask for myself and my son. Can I make my own mask, and how safe would it be?
Right. Okay. So the surgical mask really should be just for the medical professionals and the carers and that kind of thing in nursing homes, because sadly there is such a limited supply of them, and that shouldn't be the case, but unfortunately that is the reality of the situation. But yes, you can make them, and you can make them with a piece of cloth and a piece of tissue. And the best one I've seen, if you're on Twitter, or if you're on Twitter in particular, there's a lady called Dr. Cannon who's done a brilliant video of how to make a mask, and it involves just a square piece of cloth, a piece of kitchen roll, and they are highly effective. The masks really are to protect other people from your coughs and sneezes. It's not to protect you. So if you wear a mask, you're protecting others. If they're wearing a mask, they are then protecting you. The masks are not effective at protecting you from other people's droplets. So that's something to bear in mind. But Dr. Ellie Cannon, look at her video. She's done a brilliant video on how to make it, much better than I can do. I tried to copy it, but it wasn't as good, so I discarded it.
Leon says on Facebook that he's seen a video, like a 3D model video of basically showing somebody in a supermarket coughing and sneezing, and the virus, I don't know if you've seen it spreading into the next few aisles. So as an autistic person, he was concerned of that. And because he lives alone and he goes shopping by himself, he was saying, he's quite scared about this. So what precautions does he need to take in place when he does go shopping? Because he doesn't know whether, people have got the virus where he's shopping.
Yeah, I saw that video, and it was quite scary, because I saw the cloud of germs kind of jump into the next aisle to the next person, and that is very specific for a sneeze, not a cough. And so it's difficult. There's no real advice, because we don't know when people are out and about whether they've got the virus or not, and it's all about maintaining that 2 meter distance. But if someone sneezed in the aisle opposite you, unfortunately there's not much you can do if they haven't put their hand over their mouth, or they haven't sneezed into their elbow. There isn't much that can be done. And wearing a mask, if they were wearing a mask, then that would protect you, but you wearing a mask won't protect you from that cloud, unfortunately. And that's why it's really important, when you come back in from the supermarkets and that kind of thing, to wash your hands really, really well, because people touch things, and not all people are as clean as us. So yeah, you've got to just be as hygienic as possible.
Yeah, Kenneth says, when I get food from the supermarkets, do I need to, when they come back into the house, do I need to clean them down, or can I just put them away?
Okay, so there is evidence that the virus can remain on hard surfaces like cardboard and metal, for up to 3 days, some studies are saying. So if you can disinfect them without kind of disintegrating the packaging, then that's a really good idea. If you can leave them in a cupboard for 24 hours before you actually use them, that would be even better, because it's very unlikely the virus will last outside a body for more than 24 hours. Only, most studies have put it at 24 hours. But either disinfect, which is what I do when I buy my bits and pieces, or wash them if they're fruit and vegetable, really important to do, or put them in a store cupboard and don't use them for 24 hours if that is possible.
So when you say disinfect them, do you mean just wiping them down with antibacterial
wipe? I've just got an antibacterial wipe, and if I run out of them, which, because they're hard to get hold of, I just use a kitchen roll with a bit of fairy liquid and water on, and that's it.
Okay, that's great. Somebody's kind of just said, can hand sanitizers with you? Can you use? I don't know. I'm not sure what his question is. He says, hang on, let me bring it up on the screen. He says, keep hand sanitizers with you. Use bleach and water.
Hand sanitizers are effective. They're not as effective as soap and water and washing your hands. I wouldn't use bleach on any skin or anywhere inside of your body or anything like that. You know, bleach is good for hard surfaces. It's, kitchen surfaces, toilets and sinks and that kind of thing, but definitely not for use on the human body anywhere in or out.
And the last question, she just said, great job for the great factual information. Really appreciate it. Get back to it. You have a great day there as well.
That's my kind of question. I like that one.
Dr. Khan, thank you. I know your time is valuable and you're a very, very busy doctor, but I just want to say thank you so much for coming on.
Oh, my pleasure. I'm so sorry about all the technical difficulties.
Don't worry about it. It's okay.
Right, cheers.
Well, thank you. Take care. Have a great day.
Take care. Thank you. Bye-bye.
Bye. So that was Dr. Khan. I just want to say, Dr. Khan, thank you so much for being on my show today and, you know, helping so many people up and down the country and helping people with autism and parents asking and replying to your questions and your responses. Sorry, we couldn't get through all the questions, but you've got lots of questions there. Please do share the video and make people aware for the responses from Dr. Khan. So Dr. Khan, thank you for joining us today. Don't worry about the technical issues. These things happen. But have a great day, everybody. Take care.